how do I know if I have an overactive bladder? This is something that I talk to my patients all the time in the office. So overactive bladder is basically women who are going to the bathroom a lot. They will complain about, they feel that they're running to the bathroom all the time. When that urgency hits, they can't really control it. They have accidents where they're not able to hold the urine and they have their underwear is wet. Or for some of my patients, they wake up at night. Like some people will tell me, Dr. Noor, I'm waking up 3, 4, 5 times or barely able to get a night's sleep. And you can imagine like how annoying that is and how tiring that is. Many of my patients are in their 60s or older, in their 70s, and waking up at night and trying to go to the bathroom, if they're not careful, they may fall and then end up with a hip fracture. Again, not good things. So if you are somebody who's suffering with these symptoms where it's debilitating to you and it's affecting your quality of life, that's when you know you need to go and seek treatment. How do I know if you have overactive bladder? Meaning, is it pathological or is it just that I am going to the bathroom a lot? So normal voiding, meaning how many times do we go to the bathroom during the day? We usually say it's about 7 times. So if you're somebody who's going 10 times, 15 times, or every hour you're going to the bathroom, and when you go to the bathroom, maybe there's not a lot of urine, but you still feel like you have to go, those are not normal. Similarly, waking up at night once, fine. But if you're waking up at night 3, 4 times and you're barely able to get a good night's sleep, that's also not normal. That's when you need to seek help. And the good thing is, just because you go see a physician and they talk to you about treatment options, doesn't mean that you have to take like heavy duty medications or, undergo surgery that you don't want to. The good thing about everything in pelvic health is we have lots of treatment options, whether it be lifestyle changes, whether it be medications, and also, of course, procedures. So for overactive bladder as well, if you're somebody who's like, I don't want any medication, I don't want any surgery, there are simple lifestyle changes that we can talk about, like cutting down on things that can irritate the bladder, things like caffeine, soda, there's something called bladder training that we can teach patients how to do so that they can control their bladder urges a little bit better. A lot of the times I'll have my patients work with the pelvic floor physical therapist. So lots of options. So please don't suffer. Get the help that you need. And again, just because you seek a consultation, just because you see a physician, doesn't mean that you need to go through treatment options that you don't want to. We will give you choices and then you can decide what works for your lifestyle.